Okay, so the genetic disorder that I'm going to be presenting is cystic fibrosis, or otherwise known as CF. What is cystic fibrosis? Cystic fibrosis is a recessive genetic disorder that is caused by a mutation in a gene on the autosomal chromosome 7. For an individual to have CF, they must inherit 2 copies of the affected chromosome. Therefore, it is a recessive genetic disorder caused by a mutation in a gene on the autosomal chromosome 7. The gene that is affected contains information used to build the cystic fibrosis transmembrane conductance regulator, or the CFTR protein. The most common mutation is called delta F508. Out of the 61,000 letters of code in the affected gene, only 3 are missing. However, these 3 are crucial as they give instructions for putting in a specific amino acid into the completed CFTR protein. Without that amino acid present, the protein is still built in the endoplasmic reticulum. However, it is often flagged by the quality control system of the cell that it is an incomplete protein and is prepared for destruction. So often, the CFTR protein is completely missing from the CF patient's cells. How common is cystic fibrosis? It mostly affects white people of Northern European ancestry, and males and females have equal chances of inheriting cystic fibrosis because it is not a sex-linked disease. In Canada, 1 in 3,600 people are affected by cystic fibrosis, and 1 in 25 Canadians are carriers of the disease. Some symptoms or signs of cystic fibrosis are fatigue, bone complications like osteoporosis, arthritis, muscle pain, electrolyte imbalances, and dehydration. Cystic fibrosis affects systems all over the body, the first one being respiratory system. It can cause damaged airways, chronic infections, coughing up blood or mucus, collapsed lungs, and respiratory failure. CF patients are prone to lung infections, so they are recommended to be cautious of flus, cigarette smoke, household chemicals, mold, and other infection risks. Pregnancy can also worsen the symptoms of CF. The second system that CF would affect is the digestive system. It can cause constipation, nausea, loss of appetite, weight loss, nutritional deficiencies, diabetes, liver disease, intestinal obstruction, and many others. The final system that cystic fibrosis affects is the reproductive system. It can cause infertility in both men or women. However, men with cystic fibrosis are almost always infertile, while women have a chance of still conceiving, but with some difficulties. Cystic fibrosis is also a progressive disorder, meaning that the symptoms will get worse as the affected individuals age. Patients also have a shortened lifespan, and most common cause of death is respiratory failure. So, what happens in the body of someone with cystic fibrosis? The central cause of all the health complications that come with cystic fibrosis is caused by the defected or missing CFTR protein. A normal CFTR protein acts as a gatekeeper and controls the flow of chloride ions in and out of cells all over the body. A faulty CFTR protein doesn't allow chloride ions to pass through the cell membrane. Sometimes it is because the protein won't open up and allow a passage for chloride ions. However, 70 to 80% of CF patients are completely missing the CFTR protein from the cell's membrane. Because chloride ions are trapped inside the cell, fluids are also trapped inside. These fluids are necessary for the cell's surface hydration. Without these fluids, the cell's surface becomes dehydrated and the mucus that protects the cell becomes thicker. This thick mucus is more prone to trapping harmful bacteria and causing life-threatening infections. It also blocks airways and passages all over the body, causing complications in various organ systems. Individuals with cystic fibrosis will experience complications all over the body. However, it mainly affects organs or organ systems that transport fluids throughout the body. like the respiratory, digestive, endocrine, and reproductive. So, how is cystic fibrosis diagnosed? It can be diagnosed through several tests, the first one being the sweat test, which is also the most common. This tests for the level of sodium in an individual's sweat. CF patients often have high levels of sodium in their sweat. A small amount of electricity and chemicals is applied to the skin to basically make the patient sweat, and they can test the amount of sodium. Genetic testing is more accurate, and it can also test for a broader range of mutations. So a blood or sample of cells inside the cheek sample is screened for mutations that can cause CF. There are also other tests that identify symptoms that link to CF, such as a chest X-ray, a CT scan, a lung function test, or pancreatic function test. There is no way to prevent an individual from developing cystic fibrosis. However, screening of family history for signs of the mutated gene can also help identify carriers or affected individuals before it is too late. How can CF be treated? Gene therapy is an option. It is available for CF patients where a non-mutated or healthy CF gene is inserted into the patient's DNA. However, it can only clear symptoms in cells where the gene therapy is applied. So if it's applied in the lungs, then it only clears symptoms from the lungs. And it cannot undo the damage done before the treatment. So if any organs were previously damaged through CF, then it cannot undo those damages. Another option is a double lung transplant. It is for CF patients that have respiratory failure. However, the success rate is dependent on many factors, and not all patients can receive this treatment. The other treatments are not to directly treat the disease, but rather to oppress the symptoms or avoid further damage. So the first one is respiratory therapy, which can include inhaled medications of antibiotics, inflammatory medications, or airway openers. There can also be exercises or other methods to thin out the mucus and clear it from the lungs. Another option is enzyme replacement, which can be taken to help digest food, and supplement vitamins can also be taken, as well as a strict diet that can be followed to ensure that there is enough nutrients. And because cystic fibrosis can also cause cystic fibrosis related diabetes or CFRD, insulin treatment can be used to deal with the diabetes that comes with cystic fibrosis. It is also important for cystic fibrosis patients to get flu or pneumonia vaccines, since they are very prone to lung infections and infections in general. Recently, there has also been some new medications that have been approved by the FDA that help to improve the function of the faulty CFTR protein. These medications can significantly reduce the severity of CF symptoms, but do come with major side effects like liver abnormalities and cataracts. We're excited, and that's it.